You're watching the Valley's only local 10 p.m. news. First News on Fox in high definition.
Well, Congress is still working, and tonight the Senate has defeated a House effort to derail a system where Obamacare would be tied to that federal spending bill, which they're trying to get to avoid a government shutdown. Elsewhere, the Affordable Care Act becomes law tomorrow. There are a lot of questions about who is covered and how much it will cost. Julie Bursick joins me. She has some answers tonight.
Hey, Dave, good evening show. I sat down with the Human Resources Director at One Health Ohio to get a better understanding of what's all going to happen when the Affordable Care Act goes into law tomorrow. Now, starting tomorrow, Americans in every state will be eligible to start the process of getting health insurance. Now, there's no set dollar amount that I can pass along to you tonight, but I can tell you this: income does play a factor in determining your coverage. Millions of uninsured Americans will have access to affordable health care on October 1st. If you fall in this number, here's what you need to know.
It isn't free.
One Health Ohio has spent months getting ready for Marketplace open enrollment. Federal grant money allowed it to hire more people to help with the process, including counselors who will work with applicants. Income and medical condition are the two main factors in determining which package works for you.
You'll spend up to 9.5% of your income on an insurance package, and you'll get tax credits then, which can credit back, and the tax credits are immediate, to help with the cost of insurance.
Padgett says you'll also want to be aware of deductibles and out-of-pocket expenses.
As we understand it, the maximum out-of-pockets are going to be somewhere in the neighborhood of $6,350. So there are out-of-pocket maximums.
Open enrollment is for 6 months. Counselors will plug your information into a software that Padgett says is like an online tax return.
And it's going to tell you which package is most appropriate for you, and it's going to tell you what it's going to cost you.
We checked in with a Salem doctor to see if physicians will be affected on October 1st. Dr. Mike Sevilla says the big date for doctors is January 1st.
We don't know what all the final rules are yet, so there's a lot of debate and concern out there right now for physicians.
Sevilla adds patients are asking a lot of questions, and he doesn't always have the answers. In the meantime, Ohio Health One says it is prepared as it can be for the Affordable Care Act, and it will have community events to help clear up any questions. Right, so as far as people lining up outside the facility on Wick Avenue, Padgett tells me he really doesn't think that's going to happen. However, he did tell me he thinks more people will actually go to the doctor or get treatment because it is available to them. Dave?
All right, Julie, thanks very much tonight.